Lieutenant Commander Angela Price died alone in a psychiatric ward at Naval Hospital San Diego, 17 months after first reporting the patient. Safety concerns that no one wanted to hear. The official cause of death was suicide. The unofficial cause was that an entire system, from her supervisors, to her colleagues, to the investigators, to the psychiatrists, had failed her at every single opportunity. There were no villains in Angela's story, no evil conspirators, no malicious actors deliberately destroying her, just a collection of ordinary people making ordinary mistakes, each assuming someone else would step up, each prioritizing their own concerns over hers, each failing in small ways that accumulated into catastrophe. Angela's death was a collective failure, and that made it worse than if there'd been someone to blame. It started 19 months earlier, when Angela noticed a pattern in post-surgical infections at Naval Hospital San Diego. Specifically, infections in cardiac surgery patients that shouldn't have been happening at the rate they were. 3 infections in 4 months. Same unit, same type of surgery, same unusual bacterial strain. Angela was the ICU charge nurse. Part of her job was infection control oversight. When she saw patterns, she was supposed to report them, so she did. She filed a report with the Infection Control Committee. I'm seeing an unusual cluster of post-cardiac surgery infections, all involving the same bacterial strain. I think we should investigate whether there's a contamination source in the cardiac surgical suite or post-op care. The infection control nurse, Lieutenant James Morrison, reviewed her report. 3 infections in 4 months isn't statistically significant. We see occasional infections. That's normal, but they're all the same bacterial strain. That suggests a common source, or it suggests that strain is prevalent in our patient population. Without more data, I can't justify a full investigation. Morrison was overworked, managing infection control for the entire hospital, with inadequate support staff. If we investigated every cluster of 2 or 3 infections, we'd do nothing but investigate. Can we at least do enhanced monitoring, extra cultures, environmental sampling? Do you know how much that costs? How much time that takes? Morrison wasn't being dismissive, he was being realistic about limited resources. Angela, I appreciate your vigilance, but I need more evidence before I can justify that level of investigation. Angela accepted that. Morrison wasn't wrong. 3 infections over 4 months wasn't definitive proof of a problem. Maybe she was seeing a pattern where none existed. She went back to her unit, continued monitoring, waited to see if more infections occurred. 2 weeks later, another cardiac surgery patient developed the same infection. 4 infections, same bacterial strain, same surgical procedure. Angela filed another report. Lieutenant Morrison, we now have 4 infections with the same organism. This can't be coincidence. Morrison reviewed the new report, sighed. Okay, I'll recommend environmental sampling of the cardiac surgery suite, but it'll take time to get approved and scheduled. We're backed up on infection investigations across the hospital. How long? Probably 6 to 8 weeks before we can get the environmental health team out there. 6 to 8 weeks. What if there's an active contamination source? What if more patients get infected while we're waiting? Then we'll deal with that when it happens. But I can't move faster than the system allows. Morrison wasn't being obstructive, he was managing dozens of competing priorities with insufficient resources. Angela, I hear your concern, but I can't make environmental health move faster. They have their own backlog. Angela wanted to escalate, to go over Morrison's head, but to whom? Morrison was already the infection control expert. If he said 6 to 8 weeks was the standard timeline, who was Angela to argue? She returned to her unit, implemented what controls she could extra, hand hygiene monitoring, stricter gowning protocols, enhanced patient monitoring, and she waited for the environmental sampling that would take 2 months to happen. Another cardiac surgery patient developed the same infection. The 5th case. Angela was increasingly convinced there was a contamination source. 5 infections with the same organism over 6 months was beyond coincidence. She went to her supervisor, Commander Robert Nash, the chief of nursing. Sir, I've been reporting these cardiac surgery infections for months. We're up to 5 cases now. Morrison says environmental sampling won't happen for another 2 weeks. I think we need to escalate. Nash reviewed her documentation. Have you been implementing enhanced infection control measures on your unit? Yes, sir. Extra hand hygiene, stricter protocols, enhanced monitoring, and infections are still occurring. Yes, which suggests the source isn't in the ICU, It's likely in the surgical suite, or the equipment. And Morrison has scheduled environmental sampling. Yes, but not for 2 more weeks. Nash considered. Lieutenant Commander, I understand your frustration, but Morrison is the infection control expert. If he's scheduled sampling, that means he's taking your concerns seriously. The timeline might not be what you want, but it's what the system can deliver. What if more patients get infected while we wait? Then we'll address that, but I can't override Morrison's professional judgment on infection control timelines. Nash wasn't being dismissive, he was deferring to expertise. Angela, you've done your job. You've reported the pattern. You've implemented controls. You've followed up. Now we have to trust the process. Angela left Nash's office feeling unheard. But Nash wasn't wrong. Morrison was the expert. The environmental sampling was scheduled. The process was moving, just slowly. She returned to her unit, continued her enhanced protocols, waited for the sampling that would happen in 2 weeks. The next cardiac surgery patient was scheduled for the following day. Captain Michael Torres underwent cardiac valve replacement surgery. Standard procedure. Experienced surgical team. Everything went perfectly. 40-8 hours post-op. Torres spiked a fever. Cultures grew the same. Bacterial strain that had infected the previous 5 patients. Angela saw the culture results and felt sick. 6 infections, all the same organism, a pattern so obvious it couldn't be ignored. She went to Morrison immediately. 6 infections, same bacteria. We can't wait 2 more weeks for environmental sampling. Morrison looked exhausted. The sampling is scheduled for next week. I moved it up as much as I could. Environmental health is stretched thin. They're dealing with a Legionella outbreak at another facility. But we have an active source infecting patients right now. Then stop doing cardiac surgeries until we find the source. I can't make that decision. I'm a charge nurse, not the chief of surgery. Then talk to the chief of surgery. I'm doing everything I can with the resources I have. Morrison wasn't being obstructive, he was managing an impossible workload. Angela, I know you're frustrated, but I can't conjure resources that don't exist. Sampling is scheduled for next week. That's the best I can do. Angela went to the chief of surgery, Commander Patricia Hayes. Ma'am, we have 6 cardiac surgery infections with the same organism. I think we should suspend cardiac surgeries until we identify the contamination source. Hayes looked at the infection data. 6 infections over 7 months. What's our total number of cardiac surgeries in that period? Approximately 80 procedures. So we have a 7.5% infection rate. That's higher than ideal, but not catastrophically high. Hayes was looking at population-level statistics, not individual patients. Are all these patients recovering? Yes, with antibiotic treatment, but then we're managing the infections appropriately. Suspending cardiac surgeries would mean delaying procedures for patients who need them urgently. Some of those patients could die waiting. Hayes wasn't being callous, she was weighing risks. If environmental sampling finds a source, we'll address it. But I can't suspend an entire surgical program based on a moderately elevated infection rate. Angela wanted to argue that 7% was unacceptable, that each infection was a patient who suffered unnecessarily, that the pattern screamed contamination source. But Hayes had a point. Suspending surgeries meant denying care to patients who needed it. And what if the sampling found nothing? What if Angela was wrong about the contamination source? She left Hayes's office feeling defeated, but Hayes wasn't wrong either. Surgical decisions involved balancing risks. Angela returned to her unit, enhanced her protocols even more, watched the environmental sampling date approach. Environmental health sampled the cardiac surgical suite, the equipment, the ventilation systems, the water sources. Found nothing. No bacterial contamination, no obvious source, everything within normal parameters. Morrison delivered the news to Angela. The sampling came back clean. Whatever is causing these infections, it's not environmental contamination in the surgical suite. That's impossible. 6 patients, same organism, same surgery. There has to be a source. Maybe it's colonization in the patient population. Maybe it's random chance that looks like a pattern, but it's not the surgical environment. Did they sample everything? The equipment, the instruments? They sampled per protocol. If there was contamination, they would have found it. Angela felt like she was going crazy. 6 infections, same bacteria. How could there be no source? She started investigating on her own, pulled records, looked at patient demographics, surgical teams, equipment usage patterns. anything that might explain the cluster. Found that all 6 patients had been cared for post-operatively by the same perfusionist during their surgeries. A civilian contractor named David Park, who managed the heart-lung bypass machines. Angela brought this to Morrison. All 6 infected patients had the same perfusionist during their procedures. Could he be the source? Perfusionists don't directly contact the surgical field. They manage the bypass equipment. It's unlikely they'd be a transmission source, but it's a common factor. Shouldn't we investigate? Morrison was skeptical but agreed to look into it. I'll review Park's training and compliance records. But Angela, you need to be careful about accusing staff without evidence. That's how people get sued. Angela backed off. Morrison was right, accusing someone without proof was dangerous, but she couldn't shake the feeling that Park was the connection. Another cardiac surgery patient developed the same infection. The 7th case. Angela was devastated. 7 infections, an obvious pattern, and no one seemed to care as much as she did. She wrote a formal complaint to the hospital commanding officer. Sir, I have been reporting a cluster of cardiac surgery infections for 9 months. 7 patients have been infected with the same bacterial strain. Environmental sampling found nothing, but I believe there is a human source, possibly the perfusionist who was involved in all 7 cases. No one is investigating this adequately. The commanding officer, Captain Richard Walker, assigned his deputy to review the complaint. The deputy interviewed Morrison. Lieutenant, Commander Price claims you're not adequately investigating these infections. What's your response? I've done everything within my scope and resources. Environmental sampling was negative. The infection rate, while elevated, isn't catastrophic. Without definitive evidence of a source, I can't justify more intensive investigation. What about a theory regarding the I reviewed his compliance records. He's up to date on all training. No violations. No complaints. I can't investigate someone based on a hunch. The deputy interviewed Hayes. Commander, should cardiac surgeries be suspended given the infection rate? 7% is elevated but manageable. We're treating the infections successfully. Suspending surgeries would harm patients who need urgent cardiac care. I can't justify that based on current data. The deputy's report concluded, Commander Price's concerns were appropriately investigated. Environmental sampling was performed. Infection control measures were enhanced. The elevated infection rate is being monitored. No further action recommended at this time. Angela received the report and felt completely unheard. 7 patients infected, a clear pattern, and the official response was no action needed. She started questioning her own judgment. Was she seeing a problem that didn't exist? Was she overreacting? Everyone else, Hayes, Nash, Walker's deputy, all seemed to think that the situation was under control. Maybe she was wrong. But then the 8th patient got infected. The 8th infection pushed Angela over an edge. She didn't know she was approaching. She spent nearly a year reporting, escalating, documenting, advocating, and 8 patients had still been infected. 8 people who'd trusted the hospital to provide safe care. Angela couldn't sleep, couldn't stop thinking about the pattern, couldn't understand why no one else saw what she saw. She started obsessing, pulling records at all hours, creating spreadsheets, mapping every variable she could think of: surgical teams, equipment, room assignments, patient characteristics. Everything pointed back to David Park, the perfusionist. She went to Morrison again. I've analyzed every factor. Park is the only common element in all 8 infections. We need to investigate him. Morrison was losing patience, not with malice, but with exhaustion. Angela, I've looked at Park's records 3 times now. He's compliant. He's trained. There's no evidence of wrongdoing, and perfusionists don't have direct contact with the surgical field. The transmission pathway doesn't make epidemiological sense, but he's the only connection. Correlation isn't causation. You know that. Morrison softened his tone. Angela, I'm worried about you. You're fixating on this. Maybe you should take some time off. Let someone else monitor this for a while. I don't need time off. I need people to listen to me. We are listening, but we're also professionals who have to make decisions based on evidence, not hunches. Morrison wasn't being dismissive, he was being scientifically rigorous. If you get me real evidence against Park, I'll investigate. But right now, all you have is correlation. Angela left Morrison's office knowing he wasn't going to help, knowing no one was going to help. She made a decision. If the system wouldn't investigate Park, she would. Angela started following Park. watching his work patterns, observing his techniques in the OR. When she could find excuses to be there, she accessed his personnel file without authorization. Found he'd worked at 2 other military hospitals before San Diego, requested infection data from those facilities. Found that both facilities had experienced similar clusters of cardiac surgery infections during Park's tenure. Angela was certain now. Park was the source, a carrier of the bacteria, transmitting it somehow during procedures despite supposedly not contacting the surgical field. She compiled everything into a comprehensive report. 3 hospitals, 23 infections across 5 years. Park present for all of them. She took it to the hospital commanding officer directly, bypassing Morrison and Nash. "Sir, I have evidence that David Park is the source of our cardiac surgery infections. He had been associated with infection clusters at 3 different facilities." Captain Walker reviewed her report, then called in his legal officer, Commander Price. "How did you obtain infection data from other facilities?" "I requested it through informal channels." "Did you have authorization to access Mr. Park's personnel records?" Angela hesitated. "I needed to establish the pattern." "That's a no. You accessed confidential personnel information without authorization." Walker's voice was stern. "Commander, I understand you're concerned about patient safety, but you've now crossed lines. Unauthorized access to personnel files, potentially HIPAA violations if you shared patient information between facilities. This is serious. But the pattern will be investigated properly. But you're not the one who will investigate it." Walker made a decision. "You're relieved of infection control duties pending an investigation into your conduct. Report to the hospital psychiatrist for a fitness for duty evaluation." Angela was stunned. "You're punishing me for finding the evidence you refused to look for." "I'm addressing misconduct. If your evidence has merit, it will be investigated through proper channels. But you violated privacy regulations and accessed files without authorization." Walker wasn't being vindictive, he was following regulations. "Report to psychiatry, Commander." "That's an order." The Navy psychiatrist, Commander Lisa Chen, conducted Angela's fitness evaluation. "Commander Price, your CO is concerned about your behavior. Can you tell me what's been happening?" Angela explained. "The infections, the reports, the investigations that went nowhere. Park being the obvious source, the system failing to protect patients, and you accessed his personnel file without authorization, because no one else would investigate him properly. Do you understand why that's problematic?" "I understand that 8 patients got infected while everyone made excuses about resources and evidence thresholds and proper channels." Angela's voice was tight. "I understand that following the rules meant patients kept getting hurt." Chen noted Angela's agitation, her black and white thinking, her inability to see others' perspectives. "Commander, do you think it's possible you're fixating on this situation, that you might be seeing patterns others don't because you're under stress? I'm not imagining 23 infections across 3 hospitals, but you're interpreting those infections as definitive proof of Park's guilt. What if there are other explanations you haven't considered?" "Like what?" "Like random clustering, like different sources at different facilities, like coincidence." Chen wasn't dismissing Angela, she was testing her flexibility of thought. "The fact that you can't entertain alternative explanations concerns me. The fact that patients are getting infected concerns me." Chen wrote her evaluation. "Commander Price demonstrates obsessive focus on perceived patient safety issue, unable to accept alternative viewpoints, accessed confidential records without authorization when official channels didn't support her conclusions, recommend administrative leave, and continued psychiatric monitoring." Angela was placed on medical leave, ordered to attend mandatory counseling, barred from the hospital pending further evaluation. She felt betrayed. She'd been trying to protect patients, and now she was being treated like she was the problem. Angela sat in her apartment, isolated from her unit and her colleagues. Her psychiatrist had diagnosed her with adjustment disorder with mixed anxiety and depressed mood, prescribed medication, recommended she consider medical retirement. "Commander Price, you've been fighting this for over a year. It's taken a severe toll on your mental health. Maybe it's time to step back and let more patients get infected. You don't know that infections are still occurring. You're not at the hospital anymore because they punished me for trying to protect patients. They placed you on medical leave because you violated privacy regulations and showed signs of impairment." Chen's voice was gentle but firm. "Angela, I know you believe you were doing the right thing, but your methods were problematic. and your inability to accept other perspectives suggests you're not thinking clearly. Angela stopped going to counseling. The psychiatrist was just another person who didn't understand, who prioritized rules over patience. She spent her days researching obsessively, pulling public records, searching medical journals for similar cases, trying to build an unassailable case against Park. Her family begged her to let it go. Her sister visited. "Angela, this is destroying you. You need to move on." "How can I move on when patients are still being infected?" "You don't know that. You're not there anymore. You can't monitor infections from your apartment." "That's the point. They removed me so I couldn't keep exposing the problem." Her sister looked at her with concern. "Do you hear yourself? You sound paranoid, like you think there's a conspiracy." "There isn't a conspiracy. Just a lot of people who don't want to admit they were wrong." But late at night, alone in her apartment, Angela sometimes wondered, was she wrong? Had she been seeing patterns that didn't exist? Was everyone else right and she was the one who'd lost perspective? The doubt was worse than the certainty. Angela was hospitalized, involuntarily, after a suicide attempt. Pills, not enough to kill her, but enough to show she was in crisis. She was transferred to the psychiatric ward at Naval Hospital San Diego, the same hospital where she'd tried so hard to protect patients. The irony wasn't lost on her. Commander Chen visited. "Angela, we need to talk about your future. The Navy is recommending medical retirement. Your mental health has deteriorated to the point where you're not fit for duty. Because I tried to save patients. Because you became fixated on a theory that you couldn't prove and couldn't let go of, even when it destroyed your health." Chen paused. "Angela, I have to tell you something. The Navy did investigate Park after your unauthorized report." Angela looked up sharply. And they found nothing. No evidence he's a carrier. No transmission pathway. No link to the infections beyond coincidence." Chen's voice was sad. "They even brought in CDC epidemiologists, reviewed all 23 cases you identified. Their conclusion was that these were random clusters at different facilities with no common source. That's impossible. Or that's reality, and you couldn't accept it because you'd invested so much in your theory." Chen met her eyes. "Angela, there's no conspiracy. There's no cover-up. The infections at San Diego have actually decreased since you left. We've only had one cardiac surgery infection in 3 months. Whatever pattern you saw, it wasn't what you thought it was." Angela felt something break inside her. She'd destroyed her career, her health, her relationships, all for a pattern that didn't exist. "I was so sure. I know, and that's what makes this tragic. You genuinely believed you were protecting patients, but you were wrong, and you couldn't admit you might be wrong, so you kept pushing until it destroyed you." Angela was medically retired 2 weeks later, diagnosed with delusional disorder, given a disability pension, sent home to rebuild a life that no longer made sense. Angela died by suicide in her apartment. Pills again, this time. "Enough. Her sister found her with a note. "I was trying to help. I thought I was protecting patients. Maybe I was just going crazy. I don't know anymore. I'm sorry." The Navy conducted a review of her death, found systemic failures. Morrison should have investigated more aggressively after the 4th infection but was constrained by limited resources. Nash should have escalated Angela's concerns but deferred too readily to others. Expertise Hayes should have considered temporary surgical suspension but faced pressure to maintain services. Health should have sampled more comprehensively but followed standard protocol. Should have recognized Angela's deteriorating mental health but was focused on her violations. Chun should have intervened more aggressively but believed she was providing appropriate care. A single person had made reasonable decisions based on limited information and competing priorities. No one had been malicious. No one had conspired against Angela. They'd all just failed a little bit, in ways that accumulated. And Angela had paid the price. The review concluded Lieutenant Commander Price's death resulted from systemic failures across multiple areas of command, medical care, and oversight. No individual bears sole responsibility. Recommend institution-wide improvements in patient safety reporting, mental health monitoring, and resource allocation. They implemented the made the hospital better, named a patient safety award after Angela. It didn't bring her back. The CDC published a retrospective study of healthcare worker suicides. Angela's case was included. Lieutenant Commander Angela Price represented a tragic example of system failure without individual villain. She identified what appeared to be a legitimate patient safety concern. She followed proper reporting channels initially. When those channels failed to produce results she deemed adequate, she escalated both appropriately and inappropriately. When the system didn't validate her concerns, she spiraled into obsession, then illness, then death. Analysis of the infection data she collected revealed no statistically significant clustering beyond random chance. The perfusionist she suspected was exonerated by thorough investigation. Her pattern recognition, so valuable in nursing, had produced a false positive that she couldn't release. But the system failures were real. Inadequate resources for infection control investigation, insufficient support for staff reporting concerns, poor recognition of mental health deterioration, lack of coordination between supervisors, investigators, and mental health providers. No one person killed Angela Price. A collection of small failures by professionals created an environment where her concerns weren't adequately addressed and her deterioration wasn't recognized until too late. Recommendations include enhanced resources for patient safety investigation, structured support for staff reporting concerns, integrated mental health screening for personnel involved in extended safety disputes, and improved coordination between clinical, administrative, and psychiatric care. Angela's sister read the study, found it simultaneously validating and infuriating. They acknowledged the system had failed, but they'd exonerated everyone, because everyone had failed just a little bit. Not enough to blame, just enough to kill her sister. Collective failure, the worst kind, because there was no one to hold accountable, no villain to punish, no satisfying conclusion, just a good nurse who saw a pattern that might not have existed, and a system that failed her while everyone was trying their best. Sometimes that's how people die. Not from evil, from accumulated small failures, by good people with limited resources, making imperfect decisions. Angela Price deserved better, but the system that killed her was made up of people who were all doing their best, and that was the most heartbreaking part of all.